Um, Hi, welcome back everyone. And today I've brought along someone who is campaigning very actively for Young Lives versus Cancer. It's a fantastic charity, and brought him along because I think it's important to get to hear about the kind of work that charities such as this one does. So if you'd like to introduce yourself.
So hi everyone, it's me Urban. I'm an MSc Entrepreneurship student here at the University of Westminster, Malignancies campus, and I've actively been promoting Young Life versus Cancer, which is cancer diagnosed charity. So we've been focusing more on raising funds. So yeah, good to be here. I actually would like to thank Sarah for giving me an opportunity to be in this platform. This is completely beyond what I actually expected initially. To be very specific with you, I was not expecting I'll be, coming across a particular podcast platform, sharing my views, increasing awareness this way. It was beyond my expectation, but I'm actually satisfied the way we are going. Thank you for this opportunity once again.
Of course, and actually we're very glad to have you on because there's obviously the side of science. We think about the cells that, they don't undergo apoptosis, which is, programmed cell death. Because of over time there'll be these usually the thing with childhood cancer, it used to surprise me when I'd hear about it, because you think cancer is typically associated with aging, because the more exposure you've had to carcinogens in the environment, UV light from the sun, things in your processed food, potentially. So all of these things contribute to an increased risk of malignant tumours and things like that. But when you hear about childhood cancers, it just blew me away, quite frankly. So, and it must be, I can only begin to imagine, how difficult it can be for the children diagnosed. So, I mean.
Yeah, definitely. So basically, when I was actually new to, because I'm not from a medical technical background, I was not familiar with what cancer actually is. I've been listening about cancer, this and that. It's very harmful for the, this thing called human body, and there's no way out. If you're in cancer, you don't get any kind of medication. It's very difficult for you to survive. That's what I've been, hearing from a lot of people, by the way. But when I actually got an opportunity to research more on cancer because of this project, I actually got a lot of stuff, or statistics I would rather say, more about the science, medical, as well as some financial as well, how it actually works. And to be specific, when it comes to cancer, I would rather say is a kind of a disease which can happen to anyone. The one that you actually mentioned for aging, that's what I used to think earlier as well. Okay, cancer is something for the aged people, but that's not the way it actually is. It's basically from young people to the aged people. But specifically speaking, it varies upon the type of cancer that one actually is going through, one actually is diagnosed with. So I actually made a research on what kind of cancers usually people have. There's, the entire human body, whichever part the, organ that humans have, they have openness to, cancer if they are vulnerable to it. So one of the cancer which I was going through was bowel cancer, which actually I came to know about from the human statistics, that it happens more in the aged people, as well as middle-aged people. But when it comes to young people, they are diagnosed more with the brain tumors, the cancer which is related to their organs, specifically the respiratory organs, the digestive systems as well. So more or less, because they are someone they have not developed, or they were not mature enough to develop their human organs in a full manner. So that's where they are actually vulnerable, and they get exposed to these kind of cancers. So yeah, this is something that I guess as a stakeholder we should be thinking of. Cancer happens to, from the young people to the aged people, but most importantly for the young people, it's more important to focus. The reason is because they are not mature enough, they are vulnerable to these kind of diseases, and it's us who has to take care of these people who are actually diagnosed with cancer. And that's what I actually, would highlight as one of my insights through my research over this period.
Wow, I mean, you've evidently done a lot of research, and I mean that was very insightful. And as well as that, obviously there's a lot of depth with, even things like leukemia and these kind of blood cancers that are a bit harder to work with work against because of the nature. They're not exactly, solid tumours and things that you can cut out with surgery. as well. I do recall hearing about it quite a bit in children. And I think another thing to touch on, like cancer, with cancer, it's quite difficult because there's so many, like as you said, there's a lot of different organs that are affected, but there are also a lot of different genes that get targeted and get mutated. So then they become clinically relevant variants, and result in maybe a certain protein doesn't work anymore. That allows the cells to perform their normal function, and then to prevent them from dying, and it manifests into cancer and the tumours that we hear about. But of course, like the other side of the science is in terms of as well providing support. So you were briefly about to touch on that. But I wanted to know, because you think charities that get money is I guess as a stakeholder as well, you want to know where that's going, or what's being done to help people with the funds that they're getting.
Oh, okay, a good question, by the way. More often than not, when we were actually raising funds for the charity as part of our project, a lot of stakeholders were actually interested to understand how this mechanism works. Like, where does the fund go? And I guess it's responsibility of us to make that transparent to the stakeholders and let them know how the funds are being utilized.
Mm-hmm.
So I came across the challenges that the young people with cancer actually face, and the ways in which Young Lives versus Cancer charity looks after those, addressing those challenges. So highlighting those challenges in a very brief way, just like the first becomes the health for sure. Young people who are actually diagnosed with cancer, they require donations for the treatment itself. Mm-hmm. And if it's a case where they actually are diagnosed with cancer, they will require support emotionally as well. Because as I mentioned earlier, it's someone who is being affected who is not mature enough about life. They don't have much idea about what it's gonna be. So they require a lot of emotional well-being, a lot of support as well. And the third one, the challenge that I would consider for them is education as well. Because I personally was in contact with one of the victims, and I had a conversation with her. She just mentioned that being a cancer diagnosed person, it's just like you get so stuck mentally that you don't feel like focusing more on your education. Plus, you'll not be able to because you're mentally disturbed. So that's where education gets disrupted as well. So these are the challenges that young people who are diagnosed with cancer usually face. And most important, the fourth one is, it's not only the child who actually suffers, it's the entire family who goes through the situations. Because if a child is actually diagnosed with cancer, it is where the parents, both the mother and father, both has to devote much of their time in caring for the child, which is where they have to put their work aside and focus more on their health of the children. So that's how the challenges have been evolving for the families as well as the children. And here it's when Young Life versus Cancer, the charity as a whole, comes into play. So whatever challenges that are listed down, these are challenges which are actually solved or looked upon by the cancer charity, which is Young Life versus Cancer. So what they do is they actually provide support with regards to medication, which is something I actually mentioned earlier. The fund that we generate, they actually use those funds for the medication purposes, for medicines, as well as from the hospitals, as well as all of the accessories that are required to treat the patient. The second, for the education, which I actually mentioned earlier, in order to increase the level of awareness, or in order to make sure that the children are not missing out their schools or colleges in any way around, they actually invest in their education as well in some way or the other, not directly, but helping them actually educate themselves during that particular time period, as well as the most important one, the mental well-being, which is what I mentioned earlier as well. So in these ways, what the cancer charity does is they actually invest these amount of money, or they use these amount of money that they've raised from the stakeholders, and ensure that the cancer patients are well enough to deal with such kind of situations. Because after all, it's all about the support that the patients get. So if they get support in this way from the charity itself, then that's where the charity has actually been successful to act the way it is supposed to be. So this is how the charity is functioning and solving the issues till date.
Thank you. I mean, like that, there's a lot to pick apart there. So in terms of things like helping parents through difficult times, expensive treatments as well. I mean,
and most important, I'd just like to highlight one of the points which I actually missed out.
Okay.
One of the point would be like, in most of cases, I actually did a research and found a crucial point, which was that for the cancer patients, it becomes too difficult for them to transport from their home place to the hospital itself, and that consumes a lot of amount of transportation cost. And in London or in UK as a whole, the transportation is way high, the cost of living is way high. So to make it easier for such cancer patients to migrate and commute from the hospital to the place where they live, what they have done is we have actually created a home from homes, which is specifically an accommodation service for the cancer patients, which is near to the hospital that they are diagnosed with. So what happens is, if a person who is diagnosed with cancer, they actually get facilities, the accommodation facilities, they reside there, get their this thing called treatment from the hospital itself. So these accommodation services are actually provided by the Cancer Society itself. So that's how they've also been helping the people who are diagnosed with cancer in terms of commuting, transportation, everything. So I personally feel that, I guess, Young Life versus Cancer has been looking out in each and every terms which can actually add value and make it easier for the cancer patients to deal with this situation. And I think that's something I really like about the cancer charity.
That's really great, and obviously, like, their services, as you say, touch a lot of different areas. I guess, if, like, with insights from maybe current patients or cancer survivors, or that is, if that's allowed to be shared. I guess, do they feel like, or do you know, like, if people fed back about, I guess, how effective these services have been in their time going through cancer?
Yeah, so in terms of effectiveness, that's a pretty good question, I would rather say, because that's how you actually assess how the funds have been utilized properly or not. So for this, I would somewhat link this with one of the statistics which I actually got to know from the UK Cancer Research. It was more or less like it was 87% of the survival rate amongst young people who were actually diagnosed with cancer. So this is something that I would say, I guess it's 4 or 5 years of the data. Over the 4 or 5 years of period, it was like 87% in aggregate. There was a survival rate for young people who were diagnosed with cancer. And I was like pretty, yeah, that's a good one. But I was more interested to know how was this possible, because the level of cancer that young people are going through at a young age, and the level of support that is required in order to get 87% of survival rate should be enormous. And I was quite surprised that it was beyond what I expected from the societies, from the stakeholders, as well as specifically from the charities itself, that these charities who've been looking after raising funds, injecting them in order to have diagnosed cancer patients, have actually enabled them to come out of their cancer diagnosed journey and actually live a good and happy life. So 87% of survival rate is all because of these charities who've actually been contributing to the society as a whole. So just in case, if I was imagining, like, just in case if we don't have such kind of charities, such kind of societies to add value and help people in society, will we be able to come across 87% of survival rate? The answer may be no, we won't be able to. It was all possible because of the charity working towards this cause. And I guess that can be one of the ways in which you can assess the effectiveness of the charity as well as the society as a whole, the contribution. It's not something that has actually gone to vain. It's something that has been effective enough to contribute to the society and the cause as a whole. So yeah.
Wow, I did not realize 87%.
Yeah, actually.
Goodness, that's amazing. Obviously we wish it's 100.
For sure.
But the closer we can get, the better, right?
Yep.
And I guess another thing that I was wondering is how much, because obviously, like, they've got a lot of, the charity helps people a lot beyond hospital, and then also, like, with treatments. But I guess, do they also collaborate a lot with, like the NHS and things like that, in terms of, like, with the emotional support? Do the people come into the hospitals, or is it more like an outpatient service, if you could speak to that?
So with regards to the emotional support that you mentioned, it actually, as mentioned earlier, it actually depends upon which place does the patient come from. So if it's a remote place, then they do provide services specifically focused on such cancer patients. And if it's somewhat, the accommodation is near to the hospital itself, then they make sure that the hospital is able to provide such kind of services in collaboration to the patients to make it much more collective
Mm-hmm.
and in group, because I personally feel that that's a good initiative to come up with, because whenever one is going through such kind of difficult situation, it's better if it's done in group. And if it's done in a collective manner in a group, then it becomes much of a, you get a motivation as well as a moral support. And that's what the charity has been focusing on. And I guess that's what the accommodation was specifically for, so that if they could come up with any kind of initiative or programs, they could do it in a very collective manner.
Mm-hmm.
And doing so would actually, have a good or positive environment for the cancer patients. But having said so, this will not be the case every time, and specifically with those who are not able to commit because of the far distance. It's specifically a case where the charity itself has been focusing more on, as you mentioned, on a remote basis, and more or less, more often than not, it's both. I would say the physical as well as the online ones, in order to make sure that the patients are well connected with.
Yeah, I did want to touch on that because I listened to a talk fairly recently, and there was a lot of it was quite beautiful actually, and got me thinking about like the collaborations between different people and different groups in order to provide care for all sorts of patients really. But there was also a talk about different people that are important, like not just the doctors that helped with treatments, but also people like play specialists and all these different I guess well-being sessions that would be run from time to time for different patients, so that I guess, because it is quite difficult, like having to go in for all the different treatments depending on the diagnosis. I mean, there's a lot of stuff like chemotherapy, radiotherapy, and you have to go in for that a fair bit. So making sure that those children have that support around them all the time. It's great to see that all these different efforts are being teamed together to produce optimistically better outcomes for children.
Yeah, actually, and at the same time, I would just like to add, when I was actually making a visit to the podcast, by the way, a friend of mine asked, how you actually chose Young Life vs. Cancer as only one of the charity in order to raise funds, because there are a lot of charities as well working for the same cause. But personally speaking, this actually is beyond the project or the fundraising aspect. It's something that actually hits you emotionally as well. As mentioned earlier, it's first of all, it's obviously the young people who are suffering, who actually require a lot of support. So do the aged people as well. But since I'm a student, as a student, I personally feel more connected helping out young people who are actually going through the same situation, the same phase of my life. It's the same phase of life, and it's important that as a student, it becomes responsible for me to contribute in a way which actually adds value to the other student as well. And that's how my team and me got connected to this particular cause, and we made a decision, okay, let's get this done. We have to support this charity and let's raise funds for this. So we've organized numerous events for this as well in the campus itself, as well as the podcast itself. A lot of events in the days to come as well. So yeah, so this is more like we started initially as a fundraising event for the college project.
Let's put pause on it. I don't know why it's done that. I did not realize these are timed lights. What the hell? Come back.
This is gonna be cut.
This is hilarious. Yeah, obviously. So what the? Okay, you might just want to start like that bit again from where I finished. Talking about. Oops, is my hand quite warm?
Okay.
Talking about all the connections and stuff. Yeah, you got it.
So personally speaking, I actually, when I was actually making a visit to the podcast today evening, a friend of mine actually asked me, how do you came across Young Life vs. Cancer as the only charity for which you're raising funds? Because there are a lot of cancer societies as well as charities here in UK. So basically, it was quite straightforward. We never, had a long discussion in terms of determining which charity are we supposed to support. I mean, we are supporting each and every charity in some way or the other. But the main reason why we actually came across Young Life vs. Cancer was because we as students, my team members and me as students, were able to relate our life with the young people who are actually diagnosed with cancer, we actually are going through the same phase as they are, and we actually know how it feels like when you are actually a student focusing on education, but it gets disrupted because of the diagnosis with cancer, and how emotionally it's difficult for you to get through the situation. And because of that deep connection, I would say we got fascinated. Okay, let's do something for this society, charity. Let's raise funds. Initially, we actually began with the intent of raising funds because it was a part of our project as entrepreneurial skill. But later on, once we started having some events, started more of the research onto this particular project, it started becoming, okay, this is something that we are connected in a personal way rather than professional way. I would like to highlight in this way, and that's how we actually got into a bit more. We actually made a visit to other campuses as well of the University of West Windsor itself, the higher campus, and now we are here at the Cavendish campus for sure. So this would not be possible if we are not able to connect this emotionally and personally and just limited it to the project only. So I think the good cause has always something good to bring in you, which is something I personally believe this project has done. And I'm really thankful that I actually got this opportunity of working on this, raising funds for the charity, because a single penny counts. So yeah.
100%. And I think there'll be many people grateful for this effort. And I mean, I'm grateful to get to have the chance to talk about this charity and also bring about a bit more conversation around cancer when it happens at a younger phase of life. Because like you're saying, it is like we're both students, and it's just like we're here focusing on let's get this degree and stuff, but other people are wondering how's the how much is the next chemo gonna hurt. So it's just that contrast is dizzying in itself.
Exactly. It is. I mean, like this is something that I personally feel that one can only get when they actually go through the situation. It's very difficult for you to actually relate to their life, because I actually got to know more about this when I actually met one of the cancer survivors here in UK, and when I actually discussed about the issues, she was a bit not willing to disclose because of personal privacy reasons, and I really appreciate that. But later on, she actually helped me out to perform more research onto what cancer actually is. And I'm being honest with you, I was not initially able to relate myself with her because the journey that she's been through, the cancer diagnosed, and I'm looking at it as a normal perspective guy. There was something I was not able to relate to myself. But when I actually started doing more research into this, I actually felt as if I've started living my life as a person who is actually diagnosed with cancer. And that way it becomes a bit important to understand what it actually is, and you get to know it emotionally, because as I mentioned earlier, emotion is actually required because it makes it easier for you to actually understand the life that they've been going through. For a normal person, it's very difficult for you to find relevance to their life, but once you find connection, you just feel like contributing to the way it's possible for you, and that's what we've been doing. So it's just not a short-term project or a short-term goal, it's a very long-term scale of vision that we actually are working on. And for sure I'll be a part of this contribution to this charity. It's specifically the cancer focused young people, because that's what the entire country stands for. So yeah, I mean, like, this was something I never expected that I'd be working towards. So it happened.
So I mean, of course, with all this, it's in a world where I feel that humanity can be harder to find. There's a lot of apathy, there's a lot of you just think that a very tricky world, we've come out of COVID, things were very difficult then, and I mean with healthcare it's there's obviously a lot of difficulties within healthcare as a whole. So having the humanity for fundraisers such as yourself to spread the word and to contribute towards charities like this, being able to help people who are struggling through, and especially at a time where of course there are plans with for example, serving underserved communities and providing the right kind of training for future doctors and stuff like that. But at the same time, it can be quite difficult for people to get the surgeries they need, to go to the appointments that they have to go, regular checkups to monitor progress, especially through treatments that take a while. So with all this, remembering that we've got people and charities that are willing to help through such difficult times, it's definitely heartwarming, for sure.
Yeah, exactly. It is indeed, and I guess the charity has been looking onto these kind of matters as well. And more often than not, I guess things actually gradually happen, more or less. And for sure, as of now, not each and every cancer patient have been diagnosed properly. The ones that you actually mentioned is a real life issue. Actually, not each and every individual have facility to these services, and that's what the charity has been working towards. So if the survival rate is 87%, let's bring it to 100%. And I guess the gap of 30% is something that it needs to be worked on, and which is something that the charity has been working towards. But down the line, I guess over the 5-6 years down the line, I guess the cancer charity will actually be able to achieve this objective as well. And that can be a good, cause for the humanity as a whole. So yeah, and specifically focusing on the support that you mentioned, medication as well as post-medication, which is something required. So it's not like a person who was diagnosed with cancer has actually been able to overcome, but is it that it's completed or is it that it's over? No, it's not. The question is that it has to be properly cared properly even after they've been treated, and that's where medication, post-medication after cancer treatment comes into play, which is where the volunteers, specifically the student volunteers or whoever the stakeholders are willing to contribute, they can actually be a part of the charity itself and help the cancer diagnosed people once they've been treated with all of the ways, like accommodation I mentioned earlier, with the emotional well-being I mentioned earlier, with education as well. And the cancer charity, the Young Life versus Cancer, they've been doing this as well, which is focused more on the post-treatment. So that's something I really like, because it's not until you get treated, it's also after you get treated, and that's how you should be treated as human. And that's something I really like about the cancer, the Young Life versus Cancer that they've been doing. I really appreciate that.
Yeah, and that's such a good point that you bring about as well, because definitely even students think of going into healthcare, we think, okay, so we've got a patient and now the patient's gonna have a treatment plan, and then that's it. For a lot of the time, a lot of people, that's it, you're fine, you go home and go about with life, right?
Yeah.
But like in terms of long-term monitoring, making sure that there's like people out in the community as well. Like this is where we think about like the importance of having healthcare professionals, but also people out in the community to make sure that the treatments and also like the effects are being monitored long-term as well. I'm personally interested as well, like in the research aspects. Like as a biomedical science student, you do look at some of this stuff academically. So being able to see the kind of research that comes out, this drug can target this, or we have a new diagnostic tool. A couple of years back, I saw a project from King's College. And they were looking at, admittedly, I think it was different, if I want to remember, it was about targeting certain nodes, so that clinical samples from lymph nodes and things like that were being recorded by AI, and people were training the AI to be able to diagnose more accurately. So all these kind of efforts, like from a science perspective, they're exciting, but also like I guess the enormity of what they can do for people in the future. But now like also getting to hear more about the like more human side, the emotional side, the outside of the very clinical smelling hospital room. So I think it's great that we've been able to have this kind of conversation around especially young lives and how they persevere through their journeys with cancer. So I want to just thank you personally for coming today and sharing all your insights.
My pleasure.
And just reinforcing the message that collaboration is so much an important part, is integral to being able to help so many people everywhere. So thank you very much, and hopefully to everyone watching, you'll be able to see perhaps the more emotional side of what it is to be able to address young lives with cancer and everything that goes around that, because it's much wider than the one individual. It's so many people and so many efforts as well to help out. So I will leave a QR code as well towards the end just now, so if you'd like to scan that, and then we can hopefully come together ourselves and help out towards the amazing efforts of this charity.
Yeah, for sure. And also I would just like to mention that thank you, Sarah, for giving me this opportunity once again, for inviting me to this podcast to increase the awareness, and giving me an entrepreneurship student an opportunity to work on the project as well as on collaboration. And just to mention, we actually had planned to organize an event as well, but due to some logistical issues we could not. And it was Sarah's idea to have a podcast on this particular subject, which I was completely not thinking of. So it just happened, beyond my expectation, but I guess it was something I actually didn't expect it, but happened quite good. And that's something interesting, when it isn't something that you've expected but happens for sure. And I really like that. And this entire support that I actually received from Sarah is something I cannot define in words. And I'm really grateful for this show, as well as for the commitment that Sarah has been showing. She's all busy, all day, but she's been able to contribute a lot.
Please,
so thank you for this opportunity. Yeah, that's how I would like to, consider this entire show to be much more beneficial. So yeah.
And of course, beyond, before you might say that, it's actually going to help so many of us as well, people that are aspiring to enter healthcare, in terms of, how do we look at these things? We're not just looking at them through the microscope, right?
For
We've got to focus the lens.
Yeah, exactly.
Too many points. Okay, we've got to focus the lens on different aspects, which people like yourself, people who may not necessarily have a science background, but can still offer all these perspectives.
Yeah, exactly.
Being able to show this side of everything is, it's amazing, and it just goes to making everyone better and more able to, I guess, contribute in whatever way we can.
Yeah, exactly. That's what actually we should be doing as humans. So it doesn't really matter whether you are from that particular field or industry. It's all about the motivation and the intent that you are actually aiming to contribute to the society. And that's what brought our team members, my team members, to contribute to this cause. So thanks for this. Whatever has happened, it's something that was supposed to happen. We are very much happy with whatever's happened. So,
yes. And you've definitely stuck with this, so we really appreciate your dedication to putting all of this together. And on that note, thank you everyone for listening.